Welcome from the Pharma MES 2018. I'm here with Andrew from LNS Research. Please introduce yourself and what is LNS Research doing?
LNS Research was formed 7 years ago in order to be really the only industry analyst firm that works in the operational technology fields. By that I mean subjects such as quality, environment, health and safety, asset performance management, manufacturing operations, and now of course the Internet of Things and the industrial Internet of Things. We're a small Boston-based company that works with most of the large vendors and many end users in the industrial space, and I run the manufacturing operations practice and work very closely with the people in the industrial Internet of Things in order to cover the whole space that entails.
You hold today the opening keynote. What was the topic?
Really, the topic was talking about how MES and the industrial Internet of Things are going to merge over the next few years. How we have to, reconsider the operational architecture and how the people in the organization work together.
How will change the IIoT, the MES structure?
MES has been a successful industry up to a point. Up to a point, and it was early on, it was very successful in the pharmaceuticals industry because specialist players, many of whom are still around, like Behram and Rockwell, and Siemens, they made a very good job of doing electronic batch records and so on. But the world's moved on, and we're now into a world where digital transformation and Industry 4.0 are very key topics at the very highest level in large manufacturing companies across the globe. And, it's time for the MES industry to change so that it can work in that cloud-based environment, distributed environment, and one where you can actually start to get better value from the data that's been sitting inside your plants for the last 30 years and you didn't even know you had.
What is the biggest impact for the MES systems?
I think modularity, the ability to distribute them, the ability to run systems across many plants, the ability to take information from them and do new analytics and new communications with your vendors, your suppliers, and so on.
How do you think that manufacturing structure will change to smart manufacturing?
I think it'll change a lot. It's going to take a long time. And the pharmaceutical industry, quite rightly, is conservative. We want it that way.
Lots of regulations.
Lots of regulations. We're very pleased about that. But the need to change is there, because if you don't change, you're not going to be competitive. We look at some industries which are really being majorly disrupted by technology, the car industry, and many other industries, and the change of the business model. I mean, back in the late 70s it must have been late 80s, Rolls-Royce started selling thrust instead of selling aircraft engines to. And that's what you do. You buy the number of hours of thrust, and then everything else is done by the supplier, and they measure the performance of the engine in flight and report it back to their base. So as soon as the plane lands, they know what maintenance is required, and they can turn the plane around without any loss of revenue to the airline. Now, if you can imagine that in any other industry, you could have valves in your factory, and the valve manufacturer could actually sell flow. Rather than sell you a valve, and then he says, "Okay, I'll do everything about it. You need to do it with your valve. I need to do the maintenance. I'll do the replacement when necessary. I'll do the testing. I'll do the constant monitoring. And all you do is you pay me a monthly fee."
What are the current biggest projects you're working on?
Well, I can't mention any names, but we're working. We're just starting out on a project for really strategic change in a luxury goods manufacturer, where they want to start with a new factory and build an operational architecture which will allow them to be much more efficient, much higher quality, have less rework, and reduce the cost of manufacturing. And surprisingly, being a luxury goods firm, they really need to get their quality up. They struggle to have consistency out in the factory floor. Another one we're working on is in a totally different space where they're making pads for the semiconductor industry, and there they just they have a huge problem with work in process, and they really just haven't been able to manage the flow of materials through the plant, which is very complex.
How will MES, IIoT, and the connected technology change the pharmaceutical industries?
Gradually, it'll change it, and I think that what is key is that as you see new drugs coming along, there's a big demand for lower batch sizes, personalized drugs, and so on. The MES is going to play a very key role in being able to manufacture these drugs in a different environment. There's going to be different regulatory environment as people are making drugs for individuals and very large molecule drugs in very small quantities at very high cost. Then the actual manufacturing operations and how you can have a plant that can be reconfigured to run many different products through it at low cost is absolutely vital for the future of these types of the MES industry.
Thank you for your short insight.
My pleasure.
I wish you a nice conference.
Yeah, thank you.
And have fun.
Yeah, well, thank you.